You're listening to the Wellness Evolution Community Podcast. I'm Dr. Christine Smith, and this is where your body becomes something you understand again, because symptoms aren't failures. They're your body's most honest attempt to protect you. Each episode, we decode those patterns with root cause physiology, nervous system insight, and metaphors that make your biology feel alive, understandable, and trustworthy. You are smart. Your body is designed to heal. Let's remember how together. Welcome back to the Wellness Evolution Community Podcast. I am excited for this episode today with Adam Wertz, who is the CEO and founder of Rebis Health, which is a multidisciplinary clinic founded on sleep medicine and really understanding chronobiology and sleep. And Adam used to work in research in sleep and chronobiology before moving into clinical sleep medicine. But we wanted to provide some thinking for you today around what if your sleep struggles aren't a discipline problem, a mindset issue, or even really a sleep problem, but a signal that your nervous system, airway, and cellular energy systems are compensating just to get you through the night. And the sleep is actually a signal and a symptom. And this is why I wanted to bring Adam on to really talk about this, because I think a lot of people misunderstand it. So thank you so much for being here today. And I'd love if you could share with everyone anything else you'd like them to know about you. But I'd love to just dive into what is sleep medicine.
Yes. Well, thank you, Christine, for having me. I'm excited to be here. I'm excited to have this conversation, this dialogue. And yeah, we can just dive right in and let's talk about it. What is sleep medicine? So sleep medicine, historically speaking, has been and still is a label-based system, just like most Western healthcare systems. So what that means is we were giving somebody a test to diagnose them with primarily sleep apnea or insomnia. And historically it was, okay, great. Now that you've been diagnosed and you have this label, now we're going to recommend CPAP or a pill, right? That is generally how it works around the United States. Our approach is a little bit different. Our approach is, yes, we'll still determine the level of severity of sleep apnea, for example, with a home sleep test or an in-lab sleep test. But what we're getting at is we want to ask the question, why? Why do you have sleep apnea? Why do you have instability in your breathing? Why do you have insomnia? And it's those questions that start to uncover the root cause of why someone's actually there in the first place. And that's the hard work, but a lot of people aren't doing it. So we've put together a fully integrative team, everyone from Airway dentistry, functional medicine, sleep medicine, where we all come together to collaborate and recognize that we don't know what we don't know, and that we can learn from these different disciplines to actually help someone heal. That is what Rebis is.
I love that. And I love that you take like a systems approach to understanding sleep, because I think a lot of people, they'll just get diagnosed with insomnia or an airway obstruction, and they'll just think that that's the thing, when really sleep is such a bigger system in the body. And it's this very delicate state that we enter into where our cells can actually repair and clean themselves, and we can move different fluids in different areas through the body. So let's also just dive into what is sleep and like, what does it do?
Yeah, it's a really interesting question and a very complicated question, but it's actually very simple. Before we want to get into any type of mechanisms, what sleep does, how it controls the body, really what sleep is your body's way and its ability to repair and restore itself back to homeostasis. How can we bring your body back to that neutral state? And so when sleep is out of balance or is unstable, then the entire body becomes out of whack. And so for me, I like to think of it as, it's very simple. How I like to think about this is that if we look at society in general, we all go about our day, we produce trash, the cars emit, exhaust, all of these things. But then at some point, someone's coming and cleaning all these things up, right? How are we taking away the trash? How are we cleaning up the exhaust? How are we cleaning up all the byproducts that are a result of everything that we do throughout the day? That is what sleep is doing. So sleep is essentially cleaning up and repairing the systems in the body. And so if the sleep mechanism is disturbed, inadequate, unstable, we're going to have issues, and the body is eventually going to start to break down.
Well, and I always love telling people about the facts that they might not know, like your neurons actually shrink 60% when you sleep, so
Right.
that your cerebral spinal fluid can come through and clear out and clean up
Right.
all of that debris.
Right.
What are some of the other mechanisms that happen when we're either inducing sleep or like going through the other stages of sleep that people might not know?
I think the big one that I'm really excited about right now is really sleep's role in mitochondrial health. Like, to me, this is the big one.
Huge.
Mitochondria we've all known about mitochondria for a really long time.
And people forget you need energy to sleep.
Right. You need energy to sleep. But it has now become very apparent through research that mitochondrial dysfunction or impairment is associated with every major disease. They are completely linked. So when we're talking about sleep, we have to also think about it as like, well, what is sleep's role in mitochondrial health? And so mitochondria need oxygen, they need nutrients from food, they need light. So when we're sleeping, if we are having oxygen deprivation due to instability in our breathing, that is resulting not only in nervous system upregulation, but it's also resulting in the body's inability to actually provide proper oxygenation to the mitochondria, which is then in turn inhibiting the mitochondria from being able to repair themselves from all the work that they've done during the day. So these things are completely linked and interconnected. And I think it's really important for people to understand that connection to be able to put these pieces together.
So that leads beautifully into kind of what I wanted to talk about next, which is sleep as this systemic effect.
Mm-hmm.
And then with the whole mitochondrial thing, we run into this fun catch-22 where it's like, if your mitochondria aren't efficient, you don't sleep well. But if you don't sleep well, your mitochondria become more inefficient.
Totally.
Because we can't repair.
Right.
So with it as a systems approach, how do you help people manage that?
So the first thing that we want to do from a systems approach is actually like look at the system. Like what we want to look at is like, is the system functioning properly? Does the system's anatomy, is it even conducive for people to be able to breathe properly? So every single person, as far as I'm concerned, should have a functional airway assessment. And the question becomes like, what is that, right? It's all the kind of the rave right now. Everyone's talking about nasal breathing and so forth. But what we want to look at is a couple things. So yes, we can diagnose someone with sleep apnea. However, what we want to look at is, okay, what's going on with the cranial facial respiratory complex? So what that means for us is we use nasal rhinomanometry to look at nasal function, like what's going on with the nasal resistance. Is the nose able to actually breathe air in properly? So that's looking at nasal resistance and function. And then what we want to look at is we look at 3D imaging, so via 3D cone beam CTs. And so what we're looking at is like actual anatomy. So what's going on with the actual airway, right? And to put this simply, let's like think about this from like a hallway analogy, right? So if we're looking at nasal flow and our ability to breathe through our nose, it's like, okay, let's look at the hallway. Are there obstructions that are going on in the hall that are preventing air from properly flowing through the hall? So think of that as your nose. And we also can look at that in the airway as well. So like in the throat. So if we have excess fatty tissue or an oversized or a small mouth that is causing the tongue to fall back, that's an issue. And then the CBCT is going to look at, okay, well, let's take a look at the hallway. Is it the right size? Is it compromised? Are we even able to walk through it? And so these are the things that are really important. So if we're looking at form and function, we can really get to the root cause of what's going on with breathing and instability, and therefore how that ties into oxygen, nervous system, etc. So to me, that's a really important piece. Like everyone who is now coming into our clinic is having a form and function assessment, not just, oh, you have sleep apnea, here's the severity, this is what we need to do about it. It's like, how can we actually move further upstream to the headwaters and see what is causing the pollution downstream? And how can we intervene earlier? And that is not only earlier in adults, but also way earlier in children. Like this starts really, really young. And there's developmental issues that are happening with the craniofacial complex due to our current society.
Yeah, that was actually one of the reasons I wanted to bring you on, is because I love people that can talk history and anthropology and
Yeah.
all of those things. And I know that we were talking the other day about how there have been literally evolutionary changes in like facial structure and stuff. And I like to teach people about this just so they know what's happening. And then we'll
Mhm.
dive more into like, well, what do you do about it?
Yeah.
But like a lot of people don't realize that there've been these changes. Like,
Yes.
what changes have you noticed in this over time?
Yeah, and I'll be honest too, like I've learned all this over the last few years, right? And how I've learned this is by interacting and learning from the airway dentistry community. Because in the sleep medicine community, historically, as I mentioned, we weren't looking at form and function. We were just diagnosing. And so when I started to look at the airway dentistry community, they were looking at actual form and function of what's going on with the face. And that's when I started to understand, wow, our faces are getting smaller, they're getting narrower. And that's a result of a lot of societal changes. So pre-industrial revolution, the maximum distance or the minimum distance we would see between our molars, the width was like 50 millimeters. So just imagine 50, imagine that in your head. Now what we're seeing, it's around 30. So in this short amount of time, over just a few hundred years, our faces are shrinking and becoming narrower and narrower. And the societal changes that have happened that have resulted in that have been a few things. So pre-industrial revolution, we had to really chew our food. We were had to break food down. So the onset of and the introduction of processed foods has kind of reduced our need to actually chew and create mastication to like actually expand our palates open. So that's one issue. The other issue is that women who have always been working, then we're kind of put into textiles and we're into a work environment what wasn't conducive to breastfeeding. So breastfeeding, the act of breastfeeding, gets your tongue to the top of your mouth, allows your palate to expand, and it allows everything to kind of make room for the teeth. So the act of chewing and breastfeeding is critical for actual airway development. Without those, or those being limited, then all of a sudden our faces start to get narrower and narrower. The problem is our teeth are still all the same size. Our tongue is roughly the same size. So we've basically taken our house and we've made our house smaller. So now, but we don't have any room for the tongue and the teeth. So in like our generation, and the generations even a little bit before us, what was happening in the dental community was, okay, we don't have room for these teeth anymore. Let's start pulling the teeth out so then we can create these perfect smiles and make room. But what that's done is then has allowed our airway to become even narrower because now things are collapsing down even further. So the removal of teeth is actually a result of the airway becoming narrower. So these are all things that have happened over just the last couple hundred years.
So we're caught in this, I won't even call it evolution necessarily because the timeline isn't actually long enough for that. And we don't actually have natural selection in place anymore.
Right.
So really this is a functional change from our societal pressures of feeding our children processed food and no longer having to chew things or use our mouth or mastication or sucking reflex in the same way. And therefore children are developing narrower facial structures from lack of that function.
Yeah. And it's important. And it's not just children, like as in children today, the people who are kids today, it's us.
Sure.
We were part of the same thing. Our parents and my parents were like, oh, eat whatever you want. Here's processed food. Like makes life easier. Like we don't have to cook. And so we are a direct result. And so now what we're seeing massive spikes in sleep apnea and instability in breathing. People can't breathe through their nose. That's why you get this, like, it's hot topic of talk about nasal breathing. But like the reality is like you can wear nasal dilators and nasal strips all you want, but they may not work if the form and function of your face isn't adequate.
So that's like a trickier one, right? Because we're actually dealing with like the physicality of the body. How do you approach that in your practice with people?
The first thing that we want to do is, again, go further upstream. So if there are, let's back up. So we go further upstream. So we've done our nasal rhinometry test. We're looking at nasal resistance. We've done our 3D imaging. We're looking at the actual anatomy. So if we're noticing that there are issues there, we can now intervene early and we can actually expand the palate open to create space for the tongue and the teeth. And then actually take the tinted palate and widen it up like this to drop it down to decrease with deviated septums and allow improved nasal airflow. So that's kind of the approach, the proactive approach to get someone to breathing properly. And then you can add on the tools. You can add on, okay, someone has compromised nasal breathing. Let's add on some breathing strips. Someone can't breathe through their mouth. Like, okay, what can we do there? So there's all these different approaches depending on where someone's at. But again, it's like, let's look at the form and function and intervene there, as opposed to waiting till someone has really severe sleep apnea and intervening then.
Well, and this is really nice, right? Because a lot of people are always thinking about, oh, well, I can't sleep because of this, or I tried the nasal patches, they don't work for me. Well, that may have not been your problem.
Right.
So when you go to a clinic like yours, then people can get evaluated to being like, well, is it the nasal pathway? Is it the tonsils? Is it this? Is it that? Okay.
Yeah.
Love that. And I know you also like to tie in kind of the concept of the nervous system to this. So people often hear me talk on the channel about basically the 3 ways that I approach holistic care, which is the physical body, the chemical body, the mental body. Mm-hmm. We kind of just talked about the physicality of things. And then now we're kind of coming into like the chemical body, which might be like functional medicine, and the mental body, which is like stress and our nervous system tone. Mm-hmm. So like, why do these breathing mechanics influence the state of the nervous system, which then allows you to actually even fall asleep in the first place?
Yes. So in general, mouth breathing elicits a sympathetic response. So it's a fight or flight response when you're breathing through your mouth. Breathing through your nose elicits a parasympathetic response. So when you're breathing through your nose, your body and your brain knows that you're safe and that you're okay. When you're breathing through your mouth, it is a heightened response. You're automatically triggering your brain to think to yourself, okay, something's coming. We need to be prepared. So if we're not able to breathe through our nose in the evening while we're sleeping, then all of a sudden we're actually have the inability to actually go into deeper stages of sleep and have sleep disruption. So that's a problem, right? From a nervous system standpoint. We are supposed to be in a parasympathetic state the entire time while we're sleeping. And the reality is our population is not in a parasympathetic state when we're sleeping. So we're waking up actually in a sympathetic state already and then starting our day. And then this is compounding over and over and over and over again.
And that's not even counting the people that are waking up at like 3 a.m. That's just counting the people waking up who are like kind of already in that squirrely mode when they wake up.
Exactly. And so like obviously there's different levels of severity here. So depending on where you're at on the spectrum of how unstable your breathing is and whether now that's now turned into sleep apnea, where you're actually having oxygen desaturation, fragmentation in your sleep architecture.
Anybody wake up in a panic when you're suffocating?
100%. But the thing is like, we always think about this from like a sleep standpoint. Like what we always, it's a mistake to ask people like, how are you sleeping? Because when we're asleep, even when we're in a fragmented sleep state, we're not really aware. But so it's like, how are you feeling during the day? Like, are you able to function the day? How are your energy levels? Like, how's your memory? How's your executive functioning? Like, are you experiencing brain fog? Like, it's usually a bed partner that's usually telling someone, hey, you're snoring, mm-hmm. or you're breathing through your mouth, or you're tossing and turning all the time, or you're waking up multiple times in the middle of the night to use the restroom. Like waking up multiple times to use the restroom in the middle of the night is not normal. That means that you are in a sympathetic state. Your body is not able to enter into a parasympathetic, and it's waking you up to keep you alive, and you're then therefore using the restroom because you're technically not asleep. Warning sign.
Interesting.
Yeah.
So let's touch a little bit on the questions that I always get from people, right? Okay. Which is like the people who can't fall asleep, and then the people who can fall asleep, but then they regularly wake up at like 3 a.m. And then there's 2 different kinds of those people that wake up at 3 a.m. Mm-hmm. Like I have my thoughts on this. I'm really curious to hear about yours. Okay. There's the person who wakes up and they're just like kind of groggy and like a little bit out of it. And like maybe they need to drink some water or go to the bathroom, and then they go back to bed. And then there's the person who wakes up at 3 a.m. and they're like, I could run a marathon right now. Yeah. And I guess I'll check my email because I can't fall back asleep, which is like the worst thing that you can do is start to look at your phone and stuff like that.
Thing, yes.
Yep. But what is the difference between those people and like where they might be struggling?
I think that honestly, it's hard to say what the difference between those two people are, but I think they're at different levels of sympathetic activation.
Or
right?
we'll go with three. We'll go with the one who can't fall asleep, and then the two types that are waking up, the groggy and the wide awake.
The ones that cannot fall asleep.
Yeah.
So if people are unable to fall asleep, that's usually a sign that there's insomnia in play there. And so insomnia could be caused from a few different things. It could be trauma related. It could be environmental factors. It could be like their habits that they're doing during the day and bedtime. Their nervous system is completely stressed out and they're unable to regulate and get back into a parasympathetic state before they go to bed. And
these are usually the running minds and
exactly. So they're just constantly running.
Yeah.
And there's also a unconscious fear of actually going to sleep because there's likely the body knows, and maybe we're not cognitively able to articulate it. The body knows that there is actually instability and safety issues while we're sleeping, which is then like kind of triggering the person like to stay awake. Like we see this in kids a lot. This happens in children a lot.
So it's like their body knows that something's disrupted during the sleep cycle. So somatically, they're afraid to go to sleep, even though their brain is like, I'm ready to go to sleep. And then they just can't fall asleep.
Exactly.
Oh, that's fascinating. Okay. So then there's the person that wakes up at like 3 a.m. And you know, when I look at these, I think of that first person as like, that's a nervous system person. That's someone where I need to train them on how to do sleep hygiene and how to like actually prepare their brain and how to change brainwave states. And this is where breath work can come in and red light glasses come in and all the biohacking things come in and the tricks of writing down all your thoughts so that they're just out of your mind on the piece of paper next to your bed, like those types of tricks. And then the person that wakes up at like 3 a.m. And if they're waking up like really groggy like that, I usually orient back towards like the Chinese meridian clock. And I look at the organ system that's online at that time. And 3 a.m., that's usually like lung going into liver. So that's our detox time. So that person, I'm usually looking at them and being like, I wonder if your body is going through a little bit of a detox. Like, what did you take before bed? Mm-hmm. And then sometimes that person is like, I took my binder and I took all this. And they take all these detox supplements right before bed. And then I'll have a conversation with them about how to not do that and how to do it differently. Right. And then there's the person that wakes up bolt upright at like 3 a.m. And that's the person that I consider like blood sugar dysregulation. So they're usually the person that struggles with like some energy crashes during the day, especially after they eat, or they're like fasting or things aren't predictable for their body. And I like talking about this predictable nature and circadian rhythms because they totally tie into sleep. And when your body is actually trained on a timeline to enter a state where it can repair. So that's kind of like how I think about those, but I'd love to hear any other thoughts you have on that. And then we can kind of dive into more mitochondria stuff. But like even what you said about trauma, I find really interesting because trauma can be hyperactivating to the brain. And so, with the physiology of those people, like what do you see in practice?
Well, let's talk about like what is happening from a sleep architecture standpoint around 3 o'clock in the morning.
Sure.
Right. And I think that's important for us to understand. So when we go to sleep, we cycle through a few stages. So we go stage 1, which is the lightest stage, stage 2, which is the most abundant stage 3, which is like our slow wave sleep, which is really deep. And then we go into REM sleep, and that's when we're dreaming, right? And so in REM sleep, we enter into a state of paralysis so we don't act out our dreams, etc. Now, when we look at sleep architecture of how that plays out throughout the evening, the first half of the night is typically in a healthy individual should be predominantly stage 2 sleep and slow wave sleep, so deep sleep. That's happening in the first half. In the second half of the night, now we're shifting from stage 2 and REM sleep. So we're getting longer REM sleep cycles, and those will happen the second half of the night. Now, what happens in REM sleep? When we go into REM sleep, because we enter into a state of paralysis, everything relaxes. This is when breathing becomes the most unstable. This is when sleep apnea becomes the most prevalent. So sleep apnea is almost always higher in REM sleep than any other stage. So when people are waking up in those early morning hours, it's because they're having instability in their breathing. There's something there that's triggering them to wake up. And so the degree of the arousal and that they wake up probably depends on where their nervous system is at and how much they can actually respond and recover to what's happening in their instability in their breathing. So someone who has more severe breathing issues might just jolt awake at 3 a.m. and be like, oh my God, like their nervous system is online. They're ready to go. And like, they're like, I'm going to dive into work and I'm just going to go do it. Whereas the person who just wakes up and maybe they're a little groggy, maybe their instability in the breathing isn't as severe, right? But there's something there. There's a trigger. To me, it's associated immediately where my mind goes is there's sleep apnea happening in REM sleep. That's what's going on.
Well, and I remind people that our breath is our blood chemistry manager, right? People forget that how we're breathing is actually moderating the acidity and alkalinity of our blood.
Yes.
And so then if we're in the state where we're maintaining stuff all night, or say our body is going through some kind of detox shift, it would totally affect your breathing. And then if your breathing is not in the right place, then all of a sudden you have this time waking up, which is why when people come in and they ask these questions, it's not like, oh, well, this is the thing. It's usually a combination of things. And you had brought up like REM sleep, and I'd love to just teach people a little bit more about like the different stages of sleep and what's happening. Because in simple terms, we have like non-REM sleep, and then we have our REM sleep. And in the non-REM sleep, it's a lot of like filing information away. And then REM is actually like processing that information, or sometimes practicing an outcome. And that can be like what's happening in a dream, so that our brain is prepared for that experience in the future. And then REM is also where we consolidate our emotional experiences and move them through the limbic brain into long-term storage and things like that, which is why people can be more sensitive if they're not like hitting those REM states. So I'd love if you can share anything else that you know about those different stages of sleep and just what you'd want people to know about them.
Yeah, I mean, REM sleep a lot of times is associated with like memory consolidation. So there's a lot that's happening with neurocognition and REM sleep. So if we're unable to get there, there's a lot of memory impairment, executive functioning impairment that's happening.
So if you're studying for an exam, make sure you get sleep.
Yes, yeah, exactly. I mean, slow wave sleep is really helping out. This really deep sleep is really helping out with the repair mechanisms that's happening in the body. So you are out, right? You know, like someone's not even waking you up. Your body is in a state where it is truly repairing and restoring the body back to homeostasis.
This is where growth hormone is produced and all of this stuff.
Exactly. And so when sleep is impaired, or the sleep architecture is actually fragmented, then what happens is that these things can no longer produce sex hormones properly, growth hormones. So in children, we're seeing, inadequate growth hormone production. So all of these things require sleep in order for their hormones and everything to be able to properly be regulated.
So then I guess one other question I have, and I know this is like maybe less common for people, but what about the people who have like REM sleep disorder where they don't go into paralysis when they sleep? And like, what are the long-term consequences of those things?
When we're looking at REM behavior disorder, there's a high prevalence, and this has been known now, that REM behavior disorder is associated with a high prevalence of Parkinson's disease and Alzheimer's disease. So we can see the interesting piece about REM behavior disorder is like that usually is also associated with early REM onsets in the evening. So usually people who have that also have early and prolonged REM periods early in the night when you normally wouldn't have it. So if we're seeing extended REM periods early in the night, that's usually an association that there's a tie there.
Interesting. So I always love talking about these things because it's like we're still coming to understand like correlation versus causality. And so we can't necessarily like say this causes this, but there's definitely a correlation between these two things. But I think about it as if someone is unable to be paralyzed at night and they're unable to go through their lymphatic clearing process where they're clearing out various types of tangles and plaques in the brain, which is what's usually associated with those different cognitive decline states later in life. Having that accumulate over time and being unable to clear these things, I think leads to those states, which is why I think this talk is so important and helping people realize, your insomnia isn't something that you can just push to the back of your mind for the next 20 years, because if you want to have the next 60 years, you should probably really understand this. Because let's talk a little bit, we were talking about mitochondria. Let's talk a little bit about like what happens at the cellular level during sleep to support mitochondrial repair.
So mitochondria in general is requiring, they're producing energy and distributing energy all throughout the day.
Yeah.
And so as a result of that, it's also producing byproducts, right? And so what you were just referring to, we typically refer to oxidative stress, right? And think of oxidative stress as all the byproducts and the trash that's created throughout the day that we need to cleanse and take out.
I think of it like exhaust from a nuclear power plant.
Exactly. And so mitochondria is no different. They're producing energy, they're producing waste, they're producing byproducts. So they need to have the ability to be able to repair during sleep. And if they don't have the ability to repair, then they no longer can function properly, and they are no longer able to create and produce and distribute energy throughout the body. So when energy starts to become compromised throughout the body, then that's when we start to see connections with other disease states, et cetera, because the body always is going to distribute energy to and triage it to what is vital for health and survival. So over time, you have a set energetic balance and budget in your body for your mitochondria. It's always set. So if that starts to become compromised and your budget becomes less, then it's going to start to distribute to vital organs and stuff that need it and take away from other areas. And that's where you start to see all these other health comorbidities come up.
Well, and I'll see this a lot in people who have like gone through mold poisoning or something, right?
Yeah.
Their sleep sucks.
Yeah.
And it's because they literally don't have the mitochondrial efficiency to sleep.
Right.
And so when people have been exposed to some kind of toxin or they've gone through some kind of stressful event in their life, looking at their nervous system state and like their basic foundational biochemistry of supporting mitochondria at like a gentle level is usually where we start. Because people will also think, oh, to get my mitochondria healthy, I just need to take a bunch of B vitamins and go to a HIIT class. That's like later stages when we've already gone through all the detox and we've done all the like foundational groundwork. But like if you are so dysfunctional that like you can't even sleep, we're talking like baby nervous system work and like some foundational antioxidant support and like maybe a little bit of gut support. I'd love if you could talk about the functional medicine component of what you guys do in your clinic, like as we're looking at like, well, what is the first part of the mitochondria that starts to break down when it's inadequate or fragmented? And then like, what else do you guys look for to support that?
Yeah. You know, it's interesting. We're diving into this pretty deeply right now. And on the mitochondria side, there isn't really any great easy test to measure mitochondrial function. There's some new products that are coming out that we're researching right now that is making it easier, that we're contemplating bringing into our clinic to assess like energy function. But right now it's really difficult. And so were you going to say something?
I was going to say, well, we can have a whole nerdy talk later, but there are some cool labs coming out. So for anyone who's not familiar, so let's just give you like a little physiology reminder, right? So mitochondria is like the engine of your cell. The way that it makes energy is through the Krebs cycle, which is that complicated biochemistry cycle you learned about in high school that everyone thought was stupid, but actually it's really important because you use it to run every single cell of your body every moment of every day. And so this is where you see like the little complex 1, complex 2, complex 3, and like the little item moving between them, moving the electron through. And so this cycle is this very delicate thing that can get damaged with everything from, if we have leaky gut, the gut can affect the membrane of the leakiness can affect the membrane of the mitochondria because it kind of works like a water wheel. And if your membrane becomes leaky, the water starts busting through the wall. So you don't have like that power stored behind the wall, like a turbine. So it's kind of what we're talking about of like these little tiny pieces of the mitochondria that can get damaged. But then when you have other things going on in the system, it affects that tiny little mechanism.
Yes, exactly. And so for us, what we're looking at is, again, just going upstream and looking at form and function. How is your ability to breathe impacting sleep? How is that then impacting mitochondria, right? So for us, we want to basically take a look at, in our approach to like how we look at form and function is, first things first is we ask ourselves the question, is there anything that is currently that person is doing or anatomically that is harming the body? Okay, how can we remove those things and improve that? And then we use functional medicine as an adjunct to, okay, now that we realize we've improved or eliminated things that are harming the body, how do we add back in, right? So how do we add things back in, such as supplements, light therapy, et cetera, to kind of help the body get back to homeostasis, because it's been beaten down for so long at this point. So it's like removing the things that are causing harm, adding things back in, that are actually going to help and support so we can get there quicker. So your body will heal on its own if you do everything correctly. However, it takes time, especially depending on how long the detriment has been there. So it's really just removal and then adding back in. Whereas most of medicine right now is just, okay, you have X, we're just going to add. We're going to keep adding and adding and adding to kind of mask and not have to correct any of the things that are actually
these are like the
issues.
people who are taking way too much melatonin.
Exactly. Like the melatonin craze is wild, and it's kind of scary because I have 3 children.
It's a hormone. It affects your immune system.
I know, and melatonin is triggering a lot of different things in your body. And so when I see people of our my age demographic with kids, my kids are 11, 8, and 6, who are giving their kids melatonin to help them sleep. I'm just like
changing their brain development.
I know. And I'm just like, guys, there's a bigger issue here. If your child is unable to fall asleep and in the evening, we have big problems. Like there are environmental factors that may be causing that, but in a child, they know, their bodies know that they do not want to go to sleep. So they are purposely staying up to protect themselves. It is likely an airway issue that is happening with these children. And so
especially if that kid was bottle fed or processed food fed and never got to chew their food, and then they have a microbiome disruption because they were a C-section kid or whatever.
Exactly. So all these things are interconnected.
I could not say it better. And I guess if parents are seeing that in their kiddo, what's like the first thing they should do?
Well, first, like, I guess let's kind of name off a few of the symptoms that we typically see in kids as like warning signs, right? So if you are a parent and you have a child, mouth breathing is one. Is your child breathing through their mouth while they're sleeping? Are they breathing through their mouth during the day? Are they having night terrors? Night terrors, wrestling around, that's a sign of instability in breathing. Are they having, are they continued bedwetting after they've been potty trained? That's a sign. And are they having issues during the day with listening, cognition? Are they hyperactive? Have they been diagnosed with ADHD? These are the things that we're seeing across the board that are really alarming. So if those things are happening, and there's something going on.
Well, and I also want to frame it for parents of like, this is where it can be really cool to have clinics collab, right? So like their clinic addresses the sleep stuff, but one of the other things that like I'll often do in my clinic is I'll look at primitive reflexes, and like a retained Perez reflex is often associated with like nighttime bedwetting and all that stuff. And if you're not integrating your reflexes properly, your brain's not developing properly. So when we do primitive reflex checks, it's really actually like a neurologic developmental check for children. And so if we can integrate all of those reflexes mixed with the airway stuff, and then we can consider like, okay, well, if your kid's having a hard time sleeping and then they got diagnosed with ADD, is it that they have ADD and they're having a hard time sleeping? Probably not.
You're right.
It's probably that they have ADD because they're not sleeping.
Exactly.
And then it's like, okay, well, why are they not sleeping? Let's say you got the airway checked, you got the reflexes checked. Now it's like, well, what is their diet? If they are one of those picky kids and all they'll eat is macaroni and cheese and you're getting no B vitamins into their diet, they don't actually have the vitamins or the minerals to make the neurotransmitters that they need to sleep.
Right.
And so we can start integrating those things in. So this is the holistic approach of it all. And then I didn't know that the night terrors were tied to airway disruptions. That's interesting.
Yes.
Okay.
Yeah, we see that very common.
So that's great for parents.
Yeah, my daughter specifically. I mean, my middle child has had horrible night terrors. And she also has, significant form and function issues with her airway. And she was one who sucked her 2 middle fingers her entire childhood. And we always, as parents, and before I knew what I knew, I was like, oh, we got to get her to stop sucking her fingers. But what she was doing was, this is her body's natural response to because she couldn't get her tongue to the roof of her mouth. She's actually taking her fingers to the roof of her mouth to stimulate safety response to be able to get her to breathe properly. And she would sleep like that at night. And she would do that during the day in order to calm her nervous system. But because she had a tongue tie and she couldn't get her tongue to the roof of her mouth, this was her way of actually compensating unknowingly to keep herself breathing.
Oh, that's fascinating.
Yeah.
Let's do a little dive really quick, just because you brought it up, into tongue ties, because I think that's something that parents should know about. And in my profession, I also like knowing about it because it can disrupt the entire neurological system function because it's a midline tie. So if it's tied, it basically makes your whole nervous system tense and you can't reach that safety state. So what's your finding on those things?
So let's talk about tongue ties. So the first things first is like, we all know we need to get our tongue to the roof of our mouth for development. So getting our tongue to the roof of our mouth is going to help the palate expand and your mouth widen. If we are unable to get that to the roof of the mouth, that's an issue. We're going to have breathing issues. And then instead of a beautiful palate like this, it's going to become tinted, which is going to push up in your septum. It's going to cause deviations. So depending on where you're at, what age you are, and where you are at with like your housing. So if you are an infant and you have a tongue tie and you cannot latch, that tongue needs to be released. Release the tongue. You need to be able to latch. You need to get the tongue to the roof of the mouth so that the baby can breastfeed, and then we can actually start to expand the palate. Once you get older, it starts to get more complicated, right? Because now your face is, let's just say that you're pre-puberty. Pre-puberty, we still have the ability to readily and more easily expand the palate because the palatal suture has not fused. Once the palatal suture fuses, it gets more difficult. So before the palatal suture fuses, basically what we can do is we can expand the palate open, create room for the tongue, and then release the tongue. So now we got to create space in the house for the tongue before we release. If you release it before you create space in an already crowded area, the tongue is going to be all over the place and you could cause more instability in breathing. So that's the approach. So infants, release right away. If you're an adolescent, like let's expand the airway out. Adults, same thing. We got to expand the airway before we do the release. And then once we can do that, then you can start you do myofunctional therapy every single time before you do a tongue release, except in the event of an infant. So that's the process, but it should be happening across the board. Like in Brazil, babies are not allowed to leave the hospital until they determine if they have a tongue tie or not. And then if they have one, it's released automatically.
So fascinating. And especially when we were talking with everything we were talking about earlier, just how things are shifting in our society, of changes in facial structure, changes in soft tissue structure. And, there's significant changes in nervous system and development. And tongue ties are often associated with like methylation issues, and people have heard of that. And then when you think about our society and the like toxic soup that we're living in, and the amount of extra methylation that it takes to manage that toxic soup, and then people trying to be pregnant in this toxic soup while their methylation pathways are distracted doing that, even when they're taking their prenatal vitamin and stuff. So it's interesting to track these things over time and just see what's happening and figuring out how to best respond. So that's why I love talking about this stuff, because now parents have some actions they can take if they see these things happening. And I think the reason it's so important to address this stuff early is because of everything that you were just talking about, how once we reach a certain age, it's harder to make changes, especially with the massive increase in our diagnosis of developmental disorders, which I more think of it as like everyone's brain is a little bit divergent. What are the correct levels of vitamins that you need to run your brain? And if you're someone with ADD, you're probably going to need some more tyrosine and some additional B vitamins and minerals.
Correct.
And just helping people kind of understand those mechanisms. So it's more like, well, just how do we run this unique vehicle that is your vehicle? Because if we can get these things at the beginning, not only do we change brain development for children over time, we change their entire schooling experience because they can actually focus because they're not sleep deprived and dealing with all these neurochemical imbalances. And then that comes into adulthood, and they actually understand how to manage their sleep in adulthood. And maybe if they're someone that has a tendency towards mouth breathing, they're taught by dad when they're a little kid to use some mouth tape. They use that all the way through college and all the way through adulthood. And now that person has less likely outcome for cognitive decline. Because let's talk a little bit about like the long-term outcome of this compounding effect of not being able to clean your brain properly every night.
Yeah, it's concerning because, as you mentioned, like it starts really far upstream with our children. And so what we don't really truly understand right now is if we have at a really young age all of this oxidative stress, what are the long-term consequences from a neurodevelopment standpoint that these children, and then moving into adulthood, are going to be to suffer? Is the brain going to be able to recover and heal itself after 10, 20, 30 years of impairment? We don't, my answer would be, I don't know.
Especially if they like eat late night carbs.
Right, exactly. And so if we can intervene, the earlier we can intervene, the healthier we can become. It gets, the older we are, it becomes more and more difficult.
And so like when you, or I guess what patterns do you see of this link between sleep and metabolic dysfunction, immune function, mood disorders, weight loss issues, all of that?
They're all connected.
Yeah.
Every single one of them is connected. Sleep is connected to autoimmune disorders, metabolic issues, cardiovascular issues, weight changes, weight gain. Our inability to regulate our appetite is directly controlled by sleep. Leptin and ghrelin, when you are not sleeping properly, those are two hormones that tell us when we're hungry and when we're not hungry, and suppresses. Those things are completely out of whack when we're not sleeping properly. And then that results in our craving for carbohydrates, quick fixes, sugar, because we need that immediate boost to kind of compensate, because we are actually in a nervous system dysregulated state. And so the body's trying to compensate quickly to get us there.
Yes. And then when you have sleep issues, you have blood sugar management issues, and then you eat those carbs, and then your insulin overshoots, and then you crave more carbs because now your blood sugar dropped and you can't maintain your blood sugar well. And then that loops right back to what we were talking about of waking up at like 3 a.m.
Right.
So all of these are completely interconnected. And then if you're not entering that sleep state, you can't clean your brain. And then we get these plaques building up, and then they'll call it whatever form of neurodegeneration those plaques represent.
Right.
And that's what I think people misunderstand, is they think that it's like these neurodegenerative conditions are something that just like happens to you because of your genetics. And it's more like a compounding effect of your body not being able to do its normal processes over time, but you might have a genetic predisposition. But I saw you look excited. What did you want to say about that?
You're right. I mean, we know about epigenetics, and so you can be, have a genetic predisposition to these things, and some people are more resilient than others, right? But if we are resulting in oxygen deprivation and our inability, causing oxidative stress because we cannot sleep, we're going to get sick. And people need to stop viewing sleep as how much sleep do we need, and start thinking about it from the standpoint of like, how much quality sleep are we actually getting? And if we start to repurpose that question, because everyone's like, oh, we need 8 hours of sleep, or we need 7 hours of sleep. I would rather take someone who gets 5 hours of sleep and has sound quality sleep for 5 hours than someone who's getting 8 hours of sleep and it's so fragmented that their body can't actually even recover and repair. So there's a big difference there when we're looking at those things.
And sound quality of sleep would be the ability to enter that REM deep sleep state where the growth hormone is produced and the repair molecules are in action. And you'd say you need 2 hours or so of that deep sleep a night minimum.
So you rotate through your sleep cycles every 90 to 120 minutes.
Yep.
And so what I would love to see is like sound rotation through the sleep cycles, and then allowing them to take their normal course of action. So that to me is the most important piece of it, not so much the duration.
Yes, I would entirely agree with that. And I guess if you were going to give people just like one of your favorite tips for like where to start, or where you guys start in your clinic when it's more kind of maybe metabolically oriented, what do you work with people on?
When we're looking at, so first thing that we always are going to do is look at form and function. What's going on with the ability to breathe through the nose? What's going on with the anatomy? We also run blood work on everyone who's coming in. So it's nasal rhinomanometry, 3D imaging, blood work. And we're going to look at those things as well as some clinical assessment of what's going on with your mouth. Like, are you having scalping on your tongue? Are you grinding your teeth? Do you have reflux? Those are all signs of instability in your breathing. And so people are like, oh, I grind my teeth at night. I'm sure you hear this all the time. You're grinding your teeth at night, you have sleep apnea. Like it's highly likely that those two are associated with each other. So we start there. So what we want to do in our clinic is look at form and function, understand, is there something there that we need to intervene and that we need to improve, whether that's through palatal expansion, whether that's through a CPAP, whether, through nasal dilators. It all depends on the person's situation. But then we also are looking at the blood work.
What kind of blood work do you guys like to run?
So our functional medicine team has a ton of
Ton of
different
stuff,
panels that they're running, and it's all individual. We don't do the same thing on every single person. So I think the fad right now is like, okay, we're going to look at 120 biomarkers. And
You
it's
don't
like,
always need all of
yeah,
them.
you don't always need 120 biomarkers. And so it's like, how do we have a conversation with you as the individual? What's going on? And then allow our clinicians to be clinicians and decide, okay, we're going to just run a core blood work sample to see what's going on. Or do we need to run a cardiometabolic panel? Or do we need to run a autoimmune panel? Like, allow them to make those decisions, but everyone is different. And so everyone should be treated as an individual.
Because one person might have low iron and one person might have homocysteine and have similar symptoms, but totally different mechanisms that are off.
Exactly. So what they'll do is like our premise is always we use sleep as the hub to health. So we have to eliminate anything that is impacting people's ability to sleep well. Once we focus on that, now we can start layering in the functional medicine pieces. So with supplements, light therapy, et cetera, like we can start adding those things in. But all of these things start to work in concert with each other. And so that's why we have the teams that we have. So the sleep medicine piece is we're really assessing risk. What are the other sleep disorders that may be associated with? There's over 80 sleep disorders that a lot of people, there's a lot. And then how do we assess the sleep piece? From an airway dentistry piece, how that's going to focus on form and function. How do we use them to intervene on the form and function? And then the functional medicine providers are now coming in to say, okay, how can we rebuild the system? How can we get it back to homeostasis quicker? So that's our overall approach.
Okay. Do you guys use like wearables or tracking systems? Like I've even used like an Oura ring on mine. Obviously all the wearables have their errors and stuff, but it can be helpful. Like my Oura ring let me know that watching Grey's Anatomy late at night was spiking my heart rate, which I didn't know.
Interesting.
I know, right?
That is funny.
I know.
I remember that show.
It is informative.
Yeah, totally.
Who would have thought? So now I don't watch that show before bed anymore. But like, what do you guys like to use for data tracking outside of labs?
We don't provide anybody with data tracking devices because everyone is coming in with something. Sure. Right. Yeah. And when I think about data tracking, it's like, let's put it in context. Like, what are they good for? Right. And they will give you a baseline of what's happening with you. And then we'll show you where there's variations, but they aren't really a good indicator of like what time you're spending in each stage of sleep, your sleep quality. Like it is, but it is a good barometer to understand exactly what you just said. Like, oh, if I do this, this happens. So maybe I need to eliminate that. Right. Mm-hmm. The most important thing for me when I look at wearables is heart rate variability, because heart rate variability is a direct connection to where you're at with your nervous system. So I think all the sleep stuff aside, heart rate variability is the most important thing that anyone should be thinking about and looking at.
And for anyone who's not familiar with HRV, it's the idea of how well can your heart change its beat to adapt to different situations. So if you have high heart rate variability, it means you have a healthy heart that can adapt well to different situations.
Right. And so what we typically see is people who have dysregulated nervous systems as a result of impaired sleep or dysregulated sleep or a sleep disorder, they have really low heart rate variability. And so as we can improve the sleep, we should be able to increase heart rate variability. And so those things are a direct connection. And so when we have people that are sleep deprived, or they're having apneic events at night, or they're just not sleeping well because they can't breathe through their nose, those folks will tend to have lower heart rate variability scores. So that, to me, I love wearables for that purpose specifically.
Well, and that's huge because low heart rate variability has a connection to basically all disease cycles. Right. So anyone who's struggling with a chronic disease usually has low heart rate variability.
Right. And it's definitely connected to mitochondria and mitochondria's ability to produce and distribute energy. Right. And so that to me is the most profound signal that I would love for people to actually pay attention to.
Well, I think like a very simple way to say everything that we're talking about is sleep is a repair state. So how much does your body need to enter a repair state? If you're sick and not feeling well, you probably need to enter the repair state better and more often.
Yes.
If you're really resilient and you're doing great, then you probably don't need to enter the repair state as much unless you do something difficult, and then you should.
Right. And I think it's a really good way to break it down. Like if you are healthy and you're like, hey, I just want to be better and I'm going to biohack myself for longer life, you actually probably don't need as much sleep as someone who actually is sick, has nervous system dysregulation, isn't breathing well. They may need 10 hours in bed because of the 10 hours, maybe they're only getting 4 hours of quality sleep. It's so fragmented. And so really that's the key, right? It's like depending how much sleep you need is really going to depend on how healthy you are.
So well said. So as we kind of come to a little bit of a close, like if somebody really wanted to improve their sleep and have a genuinely restorative night, what would be the top points that you want them to review and know about?
I think everybody, kids included, should have a functional airway assessment done. If you don't know that information, we're going to be just kind of playing guesswork and adding things back in and not knowing the root cause of what's going on. So a functional airway assessment is very important for anyone who's looking to improve their health. The other piece I would say is like, let's just get back to basics and create a wind down routine prior to going to sleep so you can enter into a parasympathetic to give yourself a better opportunity to fall asleep. So for those individuals that you mentioned that are having such a difficult time falling asleep initially, a lot of times, like, let's do all the biohacking stuff, the sleep hygiene stuff, and let's just start creating that parasympathetic routine. That to me is really important. Bright light first thing in the morning, sunlight first thing in the morning, no sunglasses, yes. No reading glasses.
Your sleep starts in the morning.
It starts in the morning. Your circadian rhythm starts in the morning. And so if you have a misalignment with your circadian rhythm, you are actually going to have misalignment with your hormone production, everything. So wake up, get outside, get light exposure. And in the winter right now, it's harder because sunrise is a little later. So then get a light box, expose yourself to bright light in the morning to set your circadian rhythm.
Beautiful, beautifully said. And I know if people wanted, because you have a number of people on your team, including like a circadian expert that we might chat with at another point, which I think would be really fun.
I would love for you to chat with Dr. Stoddard. She would love it.
Yes. So anyone listening to this, like if you are curious about sleep or you want to learn more, like please comment, please ask us questions, and then we can make sure to answer those questions. But if people wanted to work with you and your team, can you tell them a little bit about all the people on your team and then like where they could find you?
Yes, definitely. So we have Dr. Kevin Boyd is a pediatric airway dentist.
Cool.
He is arguably the nation's leading pediatric airway dentist. He is actually based in Chicago. He's our chief dental officer. So he comes out to our clinic periodically, mentoring our airway dentists and working and helping develop our entire airway dentistry program. Dr. David McCarty is our chief medical officer. Dave has 30 years of sleep medicine experience, Harvard trained, very smart guy. And then we have Dr. Ellen Stoddard. Dr. Stoddard is our chief science officer. So she is our circadian specialist. So Dr. Stoddard is really tasked with not only looking at all of our data and proving that what we're doing is actually improving people's health, but helping advise us on what's happening with the research and how can we take what's happening in the scientific research and implement this into the clinical side. So to work with anyone on our team, all of our clinicians, the easiest thing to do is find us online at rebishealth.org. And all of are on our social media channels. We're on Instagram, Facebook, LinkedIn at Rebis Health. And you can book an appointment online or you can call and find out more information.
And that's Rebis with a B for
Rebis
anybody
with a B.
listening.
Yes.
Perfect. Well, if we were going to close with one question, what's one belief about sleep you wish people would let go of?
One belief about sleep that people let go of. That I need 8 hours of sleep. I would let go of that. I would let go of duration and focus more on quality.
Good answer.
Focus on that, to me, is the most important thing.
Beautiful answer. And that goes back to everything that we were talking about of how to get that quality sleep and really understanding that like sleep hygiene is a practice worth learning and implementing. And that'd be stuff that we can talk about on another day when we get really circadian and nerdy. Thank you so much for taking the time to talk about all this.
You're welcome. Thank you so much for having me.
Absolutely. And for anybody listening, check out Rebis Health if you need some help with your sleep, and also go back and listen. We talked about so many things. So if you're already working with somebody, like at least you know some questions that you can ask now and things that you can start to investigate, but you'd be surprised what a difference it can make getting light in the morning, keeping your blood sugar level throughout the day, and then getting your light right in the evening and not doing a bunch of stimulating things and bright light right before you go to bed and then expecting to sleep. And even just those little shifts can make a big difference.
Yes,
so
100%.
Thank you so much. And please comment with any questions you guys want to have answered, and we'll make sure to get back to you.
Thank you, Christine. Appreciate it.
Thank you for being here and reclaiming your health sovereignty. If you feel ready for deeper guidance and reconnecting to your inner intelligence and finally not going the journey alone, I created the Wellness Evolution community for that exact purpose, for you. It is a place rooted in education, foundational physiology, and community support where you can learn to trust your body again. Visit www.wellnessevolutioncommunity.com for a free quiz to find out where your body is at in your healing stages.